Hello everyone. Today we discuss about the concepts of quality care and quality management. We are already aware of that health is considered as physical, mental, spiritual, social well-being and also enjoyment of highest standards of health is fundamental human needs and right. Society as a whole has some responsibility to provide care of the sick and to prevent the occurrence of disease among its members. In the previous block, we have also learned about this. So, what is that the average patient really wants from health professional? Patient wants someone who, besides being a primary physician and an expert in diagnosis, can also give advice, allay fears, and educate. And secondly, patient is vitally interested not only in the availability of care but in its quality as well, and is also concerned with the cost of care. Thirdly, he is interested in well patient care, that is, promotive and preventive care. And fourthly, he expects personal attention as OPD or inpatient. Healthcare services include a wide variety of quality aspects, all of which are important. In case of medical services, the sellers are doctors, hospitals, nursing home, clinic, etc. because they offer health service at stipulated prices. The buyer, that is, the patient, as a customer, wants acceptable quality services which must be commensurate with what he is paying to the seller. And acceptable quality services not only include the quality of direct medical service such as diagnosis and medicines, surgery and treatment, but indirect operations such as administration, purchasing, stores, housekeeping, and linen services, and so on, are also included as their costs are reflected in what the buyer pays. It may also include quality of performance, what is directly connected and closely related to health care, such as food, housing, safety, security, attitude of employees, and other factors which arise in the context of hospital and nursing homes. Now, the concepts of quality care. You will appreciate that the key person for whom all activities are performed is the patient, and the key related to health care services is quality, which is understood as customer satisfaction. Therefore, the quality of service should always be in line with the customer's needs and expectations. The quality service may be defined based on ISO as totality of features and characteristics of service that bear on its ability to satisfy stated and implied needs of its patient. In these definitions, the features of characteristics refers to specifications relating to standards for various dimensions of quality, such as accessibility, appropriateness, continuity, effectiveness, efficiency of care, and so on. As regards the customer's stated to employees' needs. His main aim to coming to hospital is to get totally cured of his alignment or uh, um, alignment. His implied need may be treatment in the shortest time at most reasonable cost and possibly physical and emotional security. The quality of care generally means the degree of excellence of the medical care delivered, whether it it meets or exceeds accepted standards and criteria necessarily changed with improved efficiency and related to technological advancement. Therefore, standards of quality change with time. For example, in 1960s, a cardiac patient was satisfied with an ECG test, but now with newer technology, the patient probably expects a treadmill test, or an echo test. Achievement of satisfactory quality involves implementations of quality needs at all stages of process of care like diagnosis, treatment and post treatment follow up and monitoring also. Now quality of care has been defined the degree to which health services for individuals and populations increase the likelihood or desired health outcomes are consistent with current professional knowledge. So, dimensions of quality include the following: patient perspective issues, acceptability, continuity, effectiveness, quality, and efficiency. Dimensions of quality in healthcare: patient's perfect perspective issues, patient's focused functions, patient rights, organizational ethics, right to information, considerate and respectful care, right to privacy, safety, right to choose and to be heard, right to consumer education. And acceptability includes accessibility, the patient practitioner relations, and amenities, and patient preference as to effects of care, and patient's preference as to the cost of care. Now, effectiveness: degree to which the care proposed would achieve the expected outcomes given the present conditions of patient and current science and technology of healthcare. Equity: conformity to a principle that determines what is just or fair in the distribution of health care and its benefits among the members of a population. Efficiency: work of services as a whole, not the end itself but the way the end is achieved, concerned with systematic efficiency of various facilities which put together contribute forward quality of care of minimum cost. And efficacy: the degree to which the care of the patient has been shown to accomplish the desired or projected outcomes. You might wonder if an assessment of quality is at all possible, seeing the multiplicity of dimensions or attributes relevant to the concept of quality, and the possibility the goodness is one might conflict with goodness is in another. Fortunately, the principles of contextually offers a way out of the difficulty. You will appreciate that in any given situation, certain dimensions are more important and relevant. Other components can be left out, although in a different situations. Those excluded components would be the very ones to include. Now, conceptual issues relating to quality care and cost. From the foregoing descriptions, you will appreciate that prime focus in quality management is not on providing the best possible care at any cost. The whole emphasis is on making available care of an acceptable standard as per needs of each patient at the least cost. The following factors are relevant for consideration that I mentioned right now. First, preventive versus curative care. Past research finding have undoubtedly established the fact that promotive and preventive healthcare schemes are definitely more cost effective than cultivate and rehabilitative care for the population. However, at a micro level, where an individual patient is concerned, if appropriate care is rendered at OPD level, it is possible that patient admissions may be avoided. Again, as patient preventions of infections becomes important to avoid extra length of stay which add to the hospital cost. Now, manpower substitutability. So it means allocations of right job needing particular skills to be right person, and delivery of health care involves series of activities ranging from the highly skilled sophisticated activities to the most ordinary respective one. It is necessary to identify which health workers can perform tasks efficiently at minimum cost. For example, routine BP can be recorded easily by a nurse, for which doctor's time should not be wasted. Quality care versus cost. It is commonly believed that emphasis on quality means generous use of sophisticated technology, which of course result in escalations of cost, and quality care means need based care, which should ensure nothing less or anything extra done than is essentially required. Aim should be provided the best under the given circumstances, and whatever diagnostic and therapeutic procedures are necessary are carried out with maximum efficiency, effectiveness, and economy also. Now, quality care and productivity. Efficient utilizations of resources will ensure better quality, which in turn will reduce cost and increase productivity. Marketing strategies are required for ensuring optimum bed occupancy and maximum use of costly sophisticated diagnostic and therapeutic equipment. work standards are necessary for quality performance by minimum staff and to monitor labor productivity on regular basis. Clear out policies, values, analysis, adaptations of inventory control techniques, proper preventions, and break down machines, control over misuse, overuse of resources like drugs, lab, imaging facilities will add to the quality care and increase productivity by producing cost. So that's the end of the video, my friends. In the next episode, I will discuss about the concept of quality management system in brief. So thanks for watching my videos, and if you like my blogs, please subscribe, share my channel. Thanks again for watching my videos. Have a good day.